Welcome everyone to our Ask the Preventionists, our first live event. Super excited to be doing this afternoon. And before we get started with a few introductions here, just wanted to take a poll really quick to see who all is joining us today. So if you wouldn't mind, go ahead and just fill out that poll for us there to kind of let us know who we have in the room with us today. Awesome. It looks like we, of course, have lots of preventionists in the room, some educators, a few advocates, some policy workers, and some other individuals. Wonderful. Thank you so much for sharing. And so I will kind of get us started here with just introductions quickly. My name is Taylor Teichman. I'm the online resource specialist here at the National Sexual Violence Resource Center, and I help to work on some of our research to practice work that we have through the CDC. So that is what brings us to our Ask the Preventionist live event today. And I'll hand it off to my colleague, Sally, next to introduce herself. Oh, Sally, I think you're muted.
Yikes. Taylor, do you want Beth and I to jump in with intros while Sally
go right
works
ahead.
on
Thank
that?
you.
Okay.
Sure, thank you. Thanks.
I'm Destie Hohman Sprague. I'm the Associate Director of the Maine Coalition Against Sexual Assault.
I'm Beth Hamilton, also the Associate Director here at the Connecticut Alliance to End Sexual Violence.
Well, thank you.
And sorry about that, folks. Is my audio on now?
Yes, it is.
Sorry.
Yay!
I'm so happy to be with you all today. My name is Sally Lasky. I'm the Evaluation Coordinator at the National Sexual Violence Resource, where my work focuses on trying to support the rape prevention education recipients around the country. And I'm excited to learn more from Beth and Destie and folks that are joining us via chat today. So thank you. Thank you both for being here. And Taylor, thank you for organizing. To help us learn a little bit more about all of you on the line, I did want to do a quick little poll here, again, before we jump into hearing from our presenters. So we would like to know how many people live in a state or territory that currently has requirements for sexual violence prevention programming being mandatory in your schools? Thank you so much for those of you that are already responding. It looks like we do have almost around 40% of folks saying that they know that there are requirements, and we'll go ahead. I know a few folks are still adding. We'll broadcast those results for you. And thank you. So we've got some folks that aren't sure, some that don't, and about 40% that do have those requirements. So thanks so much.
Yeah, and so to get started, Beth and Destie, I was wondering if both of you wouldn't mind sharing today just kind of a brief overview of what each of your coalitions are currently doing with your K-12 prevention policy and evaluation work.
Sure. You want to go ahead? Sure. So this is the funny part of doing this all remotely with other folks around the country. So we passed our K through 12, our version of Erin's Law, essentially, in 2016. It was implemented, so started being required by schools in October of 2016. And ours includes both awareness and prevention education within schools, and that has to happen for both staff at the schools as well as for all the students at the schools. We were lucky in that we sort of had a leadership role within the development of that. So both we got to change some of the messaging and some of the work that was done. So it was much more focused on prevention than I think folks were originally anticipating happening. We worked really closely with our State Department of Education as well as the Department of Children and Families. And we developed, which I think you can click on right in one of your web links there, a guidance document ultimately that breaks down different chunks by grades essentially into what are some of the guiding principles that we want folks to be able to cover for both educators and then also for children to be able to understand within those ages. The tricky thing for us is that we were very successful in passing the legislation, but there's not a lot of teeth or accountability to what happens after the passage of that legislation. So what we're currently doing is in a process of pulling folks back around the table to do some evaluation work, an event that will be in the form of a survey that will go out to some of the same folks that we worked with earlier and some of the same principals that probably filled out. We had an initial survey that we sent out in 2014 in anticipation of doing some of this work. So I expect some of the same people will be filling that out. But what we really want to get a grasp on is what are folks currently doing, what percentage of schools, how many schools essentially are actually doing the implementation of the work, because we sort of have gotten some feedback that some schools are taking it a little bit more seriously than others. We also want to be able to find out what are some of the successes and challenges folks have faced when doing the work. And then also it's really important to identify some champions or some folks that we feel are really doing the work super well so that they can be models for other folks who are either not prioritizing it or finding some more challenges within their districts to be able to implement it. So that's what we're doing this fall. That survey will happen. And then about midway through the next academic year, our plan would be that there's a written report that goes out, sort of like a report card, which we've done, for example, when we passed campus legislation. And that's something that we can use then to get folks some more buy-in, to address some of maybe the trends that are happening for schools who are not implementing any of the education, and, as a tool to really address to see what's going on 2 years after its passage.
All right, great, thanks, Beth. I'll jump in then, is that? Okay, so we have really sort of in Maine two distinct kind of sets of prevention programming. One is for K-12, all the way through K-12 that we implement with local sexual assault support centers, MICASA member centers. But my focus here today is on just the prevention policy we have. The K-12 is our own work, but it's fairly robust. But we also passed our version in Maine of Erin's Law in 2015. So it's actually been quite a while, and it's really specific to just K-5 and specific to child sexual abuse prevention and awareness. So we're really focusing on just kind of young kids, body empowerment. And that policy has three different components. It's required training on both some concepts related to healthy sexuality promotion for school personnel, but then also like ability to identify indicators and respond effectively. That's for all personnel, including, cafeteria folks and, everybody working within the school. It also has required training for all students, or required education for all students, and that is focused on prevention concepts rather than, how to tell when something is happening after the fact. And then there's also a required policy that schools have to have a policy that aligns to a statewide Department of Education model policy. That was signed into law in 2015 or 16. I'm mortified that I can't remember now. I'm pretty sure it was 15 though. But we're actually only really fully implementing it this fall. We actually just launched the website publicly this week. So, hey, go over there. It's really great. But the intervening years have been about making sure that even though we're only focused on the K-5 or K-5 and a fairly kind of small bit of work in terms of the universe of prevention, we wanted to make sure that we had all the pieces in place for schools to really be able to implement it thoroughly. I expect that, like Beth and Connecticut, will have lots of schools who give it lip service and then lots of schools who are really committed to it. But we've been kind of building lots of pieces so that hopefully we can kind of spoon feed them to the extent that that's possible. And so we have, in addition to creating guidelines for what the school personnel training should look like, we've kind of got model personnel training. We have a whole resource guide for education for students that we've tried to make sure align with what we know about what works with prevention practice. So it's not kind of lesson plans in a box, but rather when we do prevention with kids, it needs to be multi-session. It needs to be multiple conversations. It needs to be embedded in the kind of flow of their understanding. It also should include books and reading and et cetera. And then we have the model policy as well. It's all housed in a website that includes information for schools about implementation, but also information about child sexual abuse prevention for families. That's outside the scope of the policy, but we wanted to be able to bring that in so that we had a bit of a one-stop shop. So that it all rolls out this fall, and it will include regional trainings that we'll do in partnership with the Department of Education about how to implement it, and then training for teachers so that they can become the experts within their own community, training their fellow staff and providing education or leading education efforts for kids in the classroom.
Well, we're getting, Beth and Destie, lots of interesting things coming in through Q&A. We'll ask to follow up on some of those a little bit later, but before we jump to some of those, I was wondering, since you've given us kind of an overview of your approach and what you're doing, could you talk a little more specifically about what collaborative approaches really look like in the day-to-day work of developing a state and community plan for implementing these policies, but also doing that follow-up look at evaluating if they're meeting the intended outcomes?
Sure, can start if that's okay.
Yeah, that'd be great.
Yeah, for us, it's been a bit of a challenge. I wish we had the stuff that Destie talks about every time we've talked with all of you are things that I would strive for, that I hope we have that ability at some point to put as much guidance and as much of a package together for folks to just sort of take and be able to use. For us, it's been at different times a challenge to get some of the buy-in from folks, and a lot of what we did, similar to what Destie was talking about, is we have required comprehensive sexual health education in the state. And so because that was long fought for, and there were a group of folks that had already worked on that, we were able not only to use some of their guiding documents, but to pull some of the folks who were responsible for the creation of that and who helped to get the buy-in from some of the more challenging places to be a part of our collaborative group together. And that was something that was hugely helpful, not only to sort of hear some of their lessons learned, but a little bit more about how you have to message certain things and pieces like that. We also, we really looked at who was important to have around the table and continue to do so, and thinking that, yes, we want, administrators and systems level people to be involved, because ultimately that's who's going to help us get approved to get all the work done. But we had lots of school social workers, healthcare workers, school nurses, and those folks are actually probably the most helpful, to be honest with you, in all of the folks we had around the table, because not only did they know the schools, but when we have challenges getting into the schools, those are the folks that are actually the people that we are going to directly reach out to to be able to help, who's the right administrator, who's the more sympathetic to the work we're doing. They really know both in their districts as well as in their individual schools who the right people are. So those were some of the most important people that we were able to pull together for some of those groups. We also, like I said, in doing that pre-survey, so we started a couple of years prior to really working on the legislation, and it gave folks an introduction to us in some ways, which was nice. I think that we encountered a lot of, both on the school side and from other places, a lot of resistance to this even being something that should happen in schools. That sexual violence prevention should not be something that schools are responsible for. It's a parent's job. We heard lots of those pieces. So getting folks to understand who we are and what we did earlier than we even started asking folks to support legislation or create guidance documents or now evaluate it was something that was really helpful. And we also, one of the pieces that we tried really hard to have folks engaged that we were minimally successful at in some ways was youth themselves. And that's another piece that I would hope that as other folks are doing this work, you're really mindful about. We do a lot of work for many communities, not just youth, where we really are saying, we know what's best for them, where we actually don't have them in the room telling us that information. And that's something that we had a real challenge for in a lot of ways. One, because we're set up as a nonprofit 9 to 5, Monday through Friday when they're in school. And also because there were a lot of extra hoops to jump through to get access to them, and then to keep them committed to coming back to the process and to the table, because some of them are the best spokespersons that I could think of to have at those tables. But that was some of the pre-planning and the collaboration we've done. And then we've had to do it all over again with the evaluation components, with some of the same people, trying to get them back to the table, get folks reinvested in the work. A lot of folks felt that once the legislation was passed and once we created that guidance document, we should have been done, and that we don't need to, why do we need to evaluate it? Why do we need to look at how we're doing? And for us doing the work, the reality is we fully understand that the work is being done different, even though there's some standards, it's not standardized, and that lots of folks just aren't doing the work. So we're encountering some of the same resistance doing the evaluation, but the nice thing is we have so many relationships that we built along the way that we have been able to pull back together a really good core group of folks.
Thank you so much for talking about the level of preparation that you need to do, and that it continues to be this ongoing work, and definitely for talking about putting youth at the center of this work. Destie, could you share a little bit with us about where you started, the kind of prep work you did, and who were key collaborators for you in this work?
Sure. Well, this is my turn to say, ooh, I wish we had some of that. Because what I think we have developed some really exciting resources and some fairly comprehensive resources. I think that they've also been really collaborative, but not with the wide audience that Beth refers to. And that's, for a couple of different reasons, but we had not necessarily identified Erin's Law as a priority at our coalition for lots of different reasons, including that Maine has a long tradition of being a local control state, and so we do not have any mandatory curricula for any topic at any age in Maine, and so that just kind of felt. We also additionally didn't have the resources within the sexual assault prevention and response community to implement kind of statewide blanket programming. And so when this policy was, made itself known to us, we just had not built a team, partnership, any of those things that you refer to about what would we like this to look like? We just sort of had it. And so what we did spend the time on was, well, now that we have it, what do we want it to look like? And so that was a really deep partnership between NICASA and our Maine Department of Education. So we worked in lockstep with them, their health policy and health promotion department, which is one person, because we are a very small state, who really cares about this work. We trusted her to her and that department to talk about what was realistic with the schools, to talk about what they could really implement, to bring the voices of health educators, guidance counselors, and school nurses into the process. But we really did, it was a bit of a party of two. And I think we might have done that differently if we were starting from whole cloth and, you know, envisioning how this would really be a community project. So we all work with the pieces that we're sort of given. And so for us, we thought, well, we have no money. We have almost no time. We'll be implementing this on top of what already exists. And so our collaboration was deep but small. And we worked really hard, though, to make sure that we were reaching out to local sexual assault educators who were already in schools, who were already doing related programming, like Parents in the Know, if folks are familiar with that parent education program out of Pennsylvania. I think really highly of it. And so we tried to bring our local preventionists' voices into the project. But for us, this was really an add-on, and so it took a long, long time. And I think the deep collaboration is probably what fell by the wayside in that decision-making process. I hope that what we have tried to prioritize is seeding an opportunity for local preventionists to collaborate with their local schools and school systems. And so if it doesn't exist at the statewide level, it will at least have the pieces in place so that local preventionists can engage with schools who really want to have a deep conversation about this to the extent that their capacity allows.
Great. We've got a question on the floor that I thought might be good to just insert right here on your ideas about rape prevention and the sex education worlds working together on policy and implementation. So folks would like to know how you think the work overlaps and how it might be different, or if there are any implications in doing that collaborative work.
So I can say we definitely, here in Connecticut, we see that there's a significant overlap. We feel like sexual violence prevention and discussions of sexual violence in general have to be a part of healthy sexuality, both to give folks, language to be able to talk about it, but also because we want to know, right? You can't determine what's bad without determining what's good. And so we have really great relationships with folks like Planned Parenthood and with other folks, in and outside of schools, essentially, that are doing healthy sexuality education. And we've challenged them over the years, quite frankly. I mean, I've been here for a number of years, and it took probably, 5 years in some ways for us to continuing having conversations with folks where both of us see it as something that we should be taking on and working collaboratively together in order to sort of maximize the audiences and the folks that we're in front of. Like I said, the other thing for us is that one of the really critical things that we had that healthy sexuality document, that Connecticut had already done the work of, going through the resistance, having be created. And right within, when you look at our guidance, we put theirs, each one of the guiding principles for healthy sexuality education in the state, right next to ours, because that's how closely we feel like those two things align. And also because it's a lot of the same educators doing both of the work, right? So it's health teachers, it's school social workers having the conversations with kids in both topics, right? And so the better that we can equip folks and really help them to see the connections also, the more meaningful that education is going to be.
I actually don't think I have anything to add to that, because I would totally agree that we count on our allies who also share our same philosophical approach. Even if we're not working as closely as we wish we were, just because time doesn't always permit to come up with ways to do shared or joint programming, but we count on them to also be out in the community, sharing the philosophy and being kind of partners and allies. Oh.
Allie, would you mind repeating? I think you We lost
I
your
was just
audio.
going to say, turn it back over to you.
Oh yeah, okay, thank you. Well, I think you've both already touched on this a little bit, but maybe if there's a piece that you want to share a little bit more about. I thank you both so much for sharing today and being willing to talk about how your states are doing this work. I think it's always so helpful for others to just get to hear these stories and see how this work is being done in different states. So I was just wondering if you wouldn't mind being able to maybe touch a little bit more on what has been one challenge and one success that you all have been kind of living in as of late with all of the work that you both are doing in your states.
Sure. Sorry, I'm doing a lot of talking. Destie, please cut me off at any point that I am talking too much. So for us, I think, one of the large successes is that, which is what we were just talking about, we were able to align ourselves with work and with folks who have already done some establishing work along the lines of that comprehensive sexual health education. That gave us a really amazing starting place. If there are places within other folks' states where they have things like that, I would suggest spending some time getting to know those pieces, those documents, getting to know the individuals who help put them into place. I would also say that one of our successes, which we already touched on, is being able to at different points and not as meaningfully as I hope that we would in the future, but to engage youth voices and figure out what makes sense, what kids think makes sense for them. And again, this was also thinking more high school age than elementary or middle school, but I would hope in the future we're able to engage, across that spectrum, different folks. The biggest challenge for us was probably the fact that not everybody showed up, and some of the people who were critical in moving things forward did not show up often. So we had different partners where even though they maybe were earmarked in the legislation or folks that we felt were really critical to be at the table, we had some challenges with getting folks to, stay at the table or have the right people show up. So, oftentimes people would send a designee who had no power, no ability to move something forward, but that would be who was coming to the table. So at different times, but with us, especially with creating that guidance document, we would just be at a standstill while we waited for the various systems to quote unquote approve or sort of move through that process. And so that was something that took a lot of patience and just sort of diligence as we moved through, knowing that we'd get there eventually, but being somewhat frustrated, as we move through the process.
Yeah. I would say for us, a couple of the key successes were using what already exists. And so we also have comprehensive sexuality education in Maine, but we have comprehensive health education standards, generally speaking. And so we really wanted to make sure that we referenced those, that we brought issues back to those. And so I think looking to what already did exist and connecting with it, as Beth said, was a success. But then also for us was using the policy, which I think the policy was great, but it did lead to a challenge because we just weren't really prepared in terms of capacity. It was a success for us, though, to use that policy as a launching off point to bring tools that we really wanted to have out in the community and make them available. We wanted to have a one-stop shop for schools, for teachers, also for parents, for families, for both prevention ideas, but also knowing that a lot of folks need response information right now, and that we as preventionists, have an opportunity to bring both of those to the table in the same place. Knowing that families are not dissecting, levels of tertiary prevent blah, blah, like folks just out in our communities aren't thinking like that. And so we wanted to be able to bring kind of that whole range into one place, even if it was outside the auspices of the policy. And so I think that that was a success to use that as a tool or a hook for us to bring this range of information. the challenge was really around not having the dedicated capacity. It took us easily 2 years longer than it might have otherwise. And if there are any local Maine sexual assault providers on this call, I'm sure they're sitting around thinking, wow, it's been a really awkward couple of years. Well, we couldn't get our emails and phone calls answered. And that's been hard for folks. I would also say that, one last piece in terms of the evaluation component, that a success and a challenge is that we have looked at what is, we really have wanted to focus on what's possible, what's achievable, what we know we can afford and control. And so we will not have an evaluation that will turn any of this into like magical science evidence-based programming that we'll be publishing. What we will have are some process evaluations, both to teachers who are kind of trained as the leaders and champions in their community, and some more statewide kind of school by school process evaluation, like where are you on this? Did you do the things? What other tools do you need? But we hope that we will, we have 4 or 5 different pieces that we hope will give us the information we need to continue to improve our system. But it's not, a dream outcome evaluation approach.
Thank you so much for sharing both those successes and being vulnerable enough to share some of those challenges that you all are having, because I think certainly the challenges are challenges for a reason, right? And so often that's where a lot of our growth and our learning comes from. So I really appreciate you both being able to share those today, and hopefully for our viewers that's really helpful information that they're able to take forward in the work that they're doing. And so I can kind of jump in with our last question, if that makes sense, Sally. So I was just wondering if you both wouldn't mind then sharing just what's one takeaway, what is one lesson learned maybe from those challenges, maybe from those successes, that you all would like to share with the folks who are on the call with us today, who maybe are just starting to do some of this work, or maybe, halfway through doing some of this work, or wherever it is on their journey, as I'm sure folks on the event today are probably on a spectrum of different places. But what's one takeaway or lesson?
Sure. So for us, I think part of it is thinking past. So it's really easy to get mired down in public policy work and to have that be the focus of what you're doing, right? The passing of the law. For us, I think that it would have been helpful to think more about the implementation along the way. So for us, we have a really wonderful law that includes lots of great things in there, but there is no accountability in that process. In other words, there's no report that schools are required to put into our general legislature. There is no accountability if somebody were to just say, hey, look, we're a school, we're not going to do this. And so we didn't think through what the implementation would look like. And so really, I would say, take some time to think through what schools would have to do, on a statewide level and across that, K through, at least for us, K through 12 spectrum, what they would have to do to implement it. But then also, what does it mean if they're not, right? So what are the ways in which we could build in some, even if it's indirect accountability or some, pieces along that way, what are the both intended and unintended consequences of, building those pieces? And I would say, take a look at that. I wish we had done more of that.
Yeah. I guess my kind of takeaway lesson learned, or what I would offer to folks thinking about doing this, is that I think it's really important to honor modest goals and achievable goals. And I am, as a preventionist who has also spent a number of years as essentially a lobbyist or policy person, I think it's really okay to identify incremental goals. And so, hold in your mind what the dream is, and in the meantime, just chip away at what's possible, you know. So it doesn't have to be everything now. I've been working on this policy, or some element of this policy, for about 8 years in my current role. And if I stay, which I expect to, I imagine I have a good 6 years of work ahead of me before we're close to the dream. And so if you don't have $1 million, and I'm guessing you don't, then, you know, pat yourself on the back for having a vision and just doing the tiny, tiny pieces to get there. And that might be a more modest policy. It might be a more modest training or education. But, you know, look at your strengths, look at where the barriers are going to be, and then just throw all your effort at the small, achievable, and practical wins that will lead you down your path toward a bigger, you know, and more maybe exciting future later.
Thank you. Yeah, and that's a great connection to something I want to let folks know will be coming. We're really grateful that Dorothy Esplanage out of the University of Florida has offered to do a follow-up blog for us about this complex, how to evaluate a complex process like this. So she's going to be able to provide some tips, some things to consider, and I know some folks have posted in the Q&A asking if any of the evaluation tools and instruments that you two are using will at some point be available for others to look at, adapt. So you're welcome to share any thoughts you have about that now, or we can also follow up in our blog piece about any evaluation instruments that seem to be working.
So we're happy. I mean, I can't entirely say that myself, but I anticipate that we'd be very happy to share. We are working with that group, so this fall we would put out that survey. So I don't see any reason why we could not share, you know, the survey questions that we use to ask schools how they're doing with implementation.
And I think we would also be happy to share. We don't have proprietary tools. I would say that I think our approach, I'm not positive how many of our tools could be picked up and used elsewhere, because it's a collection of, like, oh, you know, our statewide omnibus public opinion survey will gift us one question. All right, so that's something. That's one piece. And also, will all of the educators that we train, we will ask a process. You know, did you do step 1, 2, 3, 4 at the end of the school year? And so I guess I would say that that's both it's more complicated than a shareable tool, but it's also a really good example of how you cobble together something out of nothing.
Well, that connects to another question that's come up in a few different ways through the Q&A, and that's really wanting to know if you have any recommendations of specific training and curricula looking at factors for youth perpetration, but also about educator abuse against youth. And I know in your guidelines and your tools that are available in the web links, there are some things that are referenced there, but are there any kind of takeaways that you'd like to share about, you know, a statewide mandate for the use of specific tools for this work, or approaches to do community-specific development of the training and educational curriculum used in schools?
I don't know what I could point to beyond there are some pieces, like you said, that are in, you know, some points of reference within that guidance document. We're still, as a state, working to get within our youth data collection, so I think they're biannual questions. We have no questions about perpetration whatsoever that are asked to youth, and our only sexual violence questions are linked to relationships. So for us, we have a lot of work to do within our state to actually get some of that data. And my hope is that in the short term that we will see some of those questions getting added and being able to pull out. I don't have an answer in terms of teacher abuses beyond to say that you could probably get some really good examples from the news and use those as points of reference or conversation starters with, the folks that you're working with. But I think perpetration stuff we have a harder time asking those questions because we don't always have solutions, and it makes folks, especially within schools, in my experience, what they tell me is that I have to do something about it, and that's much scarier because once you identify a problem, you have to identify a solution. So I don't have a ton, unfortunately, that I would necessarily be able to direct folks to. I'm sorry.
It is not your responsibility to have an answer. I think we're working as a large global community for those answers. So thanks for all that
the only thing I
offer.
would add is that I do think that there more and more are good resources for, say, hiring, screening, and training incoming school professionals or professionals who are working with youth. And that sometimes we think of that kind of work as outside the role of preventionists, but it doesn't have to be. It's connected, it's related. It's certainly the policy in Maine is silent on that, but that's a good example of one of the things that we just went ahead and added in since we were making the website. So we don't have tools of our own related to that, but we did make sure in our supporting schools and systems section that we were kind of pointing to places where schools can increase safety simply by ensuring that their practices around hiring, screening, and orienting staff are really tight.
Thank you so much. There have been a lot of resources shared in the Q&A as well. There are some new programs being funded through the Vision of Hope Fund out of Pennsylvania. Folks have mentioned Sesame as a resource for educator sexual misconduct. So thanks for folks that have been able to share that.
And then just being mindful of our time, we have about 3 minutes left, so we want to just leave it open for potentially any other questions that come in the next minute or so. And then if not...
The only other thing I was thinking as I was, prepping for us and I've been talking with you all is that it's been interesting now as a parent, right? So I worked on this legislation professionally. I have 2 young daughters, one of whom entered into public schools recently. And so it's been interesting even as a parent to be able to then go to the school administrators, which clearly I'm comfortable doing, and challenging them and seeing how much they do and don't know. And I live in a pretty progressive, town within, Connecticut. And so it's been fascinating to see the ways in which, as a parent, right, how that plays out differently and how much, my assumption is how much education schools are giving to the students and how much, what that can look like and what it doesn't look like in terms of my expectations and how much they're meeting them. So it's been interesting to literally take the legislation, take the guidance document in to meet with my daughter's principal and the head of social work there and be like, so did you know this is there? What are you doing in that way? And that's not something that I thought of, a few years ago when I was doing this work. But for those folks who are parents, you have a really unique opportunity, even more than we have as professionals, going in there to be able to use these documents, right, and challenge folks and say, hey, I'm a parent, I'm one of your stakeholders, you get to, answer me, in terms of what you're doing with these pieces. So it's been an interesting and another conversation to have in an entirely different lens than I ever anticipated a few years ago.
I had my kid's second grader read our implementation guide and tell me all the places it went wrong. So don't hesitate to make your neighbors and coworkers and everybody help you.
Right.
Sally, you're mute again.
Sorry about that. I'm really grateful for you all, and I see that folks are sharing their thanks for offering your insights, your experience, especially some of these gems like you just shared about all of the different ways that we can be working to create safety for the folks in our community. And I see that there is a resource coming out from the Minnesota Coalition Against Sexual Assault about how to message comprehensive sex ed, healthy relationship education to schools and parents. That's going to be useful. So right on. Thanks, Minnesota.
Well, thanks everyone for joining, and Beth and Destie, thank you so much for being amazing conversationalists today and for sharing all of your experiences with us. And everyone, we will make sure to get that blog post ready and available with additional resources out to you all as soon as we can. So be on the lookout for those and for our next Ask a Preventionist live event.
Yeah.
Which should be happening in September. So
Thanks, everyone.
Thank you all so much.